Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting into our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review books, review courses, videos, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to help you as needed. Now, I always get into the disclaimer and reminder before getting into our questions, just so we know that there's no absolutes in medicine. We treat on a patient by patient basis, and any of these questions I have designed and created based on the guidelines that are currently being tested on the ANCC and AANP exam, just to give you an idea and help you to study and practice and learn how to apply the knowledge that you have to the questions that you may be presented with on the exams, okay? But anytime that I am doing videos and teaching you on things that we currently do in practice, I will always say that so there's no confusion, okay? So, with that being said, let's get into question number one for today. All right, you guys, so question number one states a 67-year-old female presents to the office today for follow up. She denies any complaints at this time. The patient inquires about mammograms and how often she should maintain getting them. The nurse practitioner notes that she does not have any past abnormal test results. What is the best response by the nurse practitioner? Is it A, mammogram should be completed annually? B, since you are older than 65 and have no abnormal results, you will need mammograms every 2 years? C, as there is no history of abnormal results, you do not need any further mammograms. Or D, as there is no history of abnormal results, you will need mammograms every 3 years. Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend that you read the stem of the question first. The stem of the question being that typically the very last sentence of the full scenario, but the one with the question mark, so that you are able to slow down. It allows you to slow down, really focus in, and ensure that you're answering what is even being asked here. So, the stem of the question here states, what is the best response by the nurse practitioner? All right, so what are we responding to? So it's a 67-year-old female that comes in for follow up, doesn't have any complaints or issues. She's inquiring about how often she should maintain getting her mammograms. The nurse practitioner notes that she doesn't have any past abnormal tests. So you need to know the criteria of mammograms. That's simply what it is, a knowledge based style question for screenings, right? In women. So is it A, mammogram should be completed annually? Now, although this is correct, let's look at her age. So mammogram should be completed annually once started, right? So we have that differentiating age group now that guidelines have changed. Typically, 40 years old is when we start, but at 40 you can start to let women know that if they don't have any past, they don't have risk factors, they don't have first degree relatives that have been diagnosed with breast cancer, then they can choose to start mammograms at the age of 50. Always explaining the risk and benefits of doing this, but letting them know guidelines state that we can start at 50, okay? And once they start at that age, you do it annually, all right? But this lady is 67, so let's keep going. So since you are older than 65 and have no abnormal results, you will need mammograms every 2 years. Now, B is correct because guidelines say if they are 65 and older with no abnormal results, they can continue every 2 years instead of every year, right? C, so B is your answer, but let's see what else we have up here. C says, as there is no history of abnormal results, you don't need any further mammos. That's not true. We continue mammograms. Mammogram is one of those screenings that all the way up to age 74, we say continue it. Some people question from 75 and on, do they need to? But according to the American Cancer Society and their guidelines and what the test follows, they have not proven whether it's more beneficial or not. So they don't tell you to stop. That's more those judgment calls by the provider. So just knowing this, the test is not going to ask you something that has not been, concretely identified and proven. So if you're wondering on that, just know to continue it out, we say at 70 up to 74, continue on, and doing it every year. And if they don't have any risk factors from 65 on up, it's every 2 years. Okay. All right, question number 2 states the nurse practitioner and NP student are discussing STDs, STIs. The nurse practitioner is explaining those that may have cervical motion tenderness. Which two are the appropriate STDs that may have cervical motion tenderness? Is it A, bacterial vaginosis and trichomonas? Is it B, gonorrhea and chlamydia? C, HIV and syphilis? Or D, pelvic inflammatory disease and trichomonas? Take a moment and tell me what you got in the comments. Tell me what you got, you guys. Tell me what you got. All right, so stem of the question states, which two are the appropriate STDs that may have cervical motion tenderness? All right, so is it A, BV, and trichomonas? No. You know, bacterial vaginosis, they may have the white discharge, the fishy odor, trichomonas, strawberry cervix, but no cervical motion. Tenderness, they may have the yellow discharge with trichomonas. B, gonorrhea and chlamydia. Yes, they both commonly present with that cervical motion tenderness. Gonorrhea also typically has like a greenish discharge. So be familiar with those common presentations, okay? So your best answer is B, gonorrhea and chlamydia. All right, and question number 3. The nurse practitioner and NP student are discussing fifth disease. The nurse practitioner is explaining the other name for fifth disease. Which is correct? Is it A, roseola, B, rubella, C, erythema infectiosum, or D, rubeola? Take a moment and tell me what you got. All right, so stem of the question states the nurse practitioner is explaining the other name for fifth disease, which is correct. Is it A, roseola? No, remember, roseola is sixth disease, SIXTH disease. So I always say, think of roseola already has an S in the name and an S for six. And I say, think you were sick previously and have gotten well, and that's when the rash comes, right? So S for sixth disease. So that's not your answer. B, rubella. No, we know rubella is also known as German measles, right? C, erythema infectiosum. Yes, that is the other name for fifth disease. Fifth disease, erythema infectiosum, also known as that slapped cheek appearance. And then lastly, rubeola is measles, right? So just remember the names and their alternate names because if a question tells you in any shape, form, or fashion, you should know, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, and subscribe. I appreciate all of y'all. I see y'all sharing, liking. I'm seeing y'all subscribing. It's completely free to subscribe, but it also helps, the algorithm so that other people can see the channel as well. As many of you have said to me, where were you all this time? And I'm like, y'all, I've been here. I've been doing courses and teaching since 2015. So it just shows that it needs to be out there more. So share it, subscribe so other people can also see it as well. But thank you for all of y'all's participation. If you need any other resources that I offer, just contact the Nursing Studio at 803-400-6864. You can also shoot a text message to this number or shoot an email to the Nursing Studio, the number 1 at gmail.com. All right, so a few things that we offer, as I always like to just run through because I get these questions often. So I have a review book that I offer in an ebook fashion as well as a paperback option. Both are linked in the bio of this channel. It's broken down by system. It is in color because I have images in so you can tie it all together. It is broken down, and you know how I go on my rant and I teach from assessment, diagnosis, evaluation, and treatment. There are interactive sections that are fill in the blank style questions broken down into that assessment, diagnosis, and evaluation and treatment for each diagnosis for each system as well. And also there's practice questions at the end with rationales. Ebook option, you have instant access on any devices that you want to review it on. And then the paperback option, of course, has to be shipped. Again, both are linked in the bio of this channel. Then we have the self-paced independent review course for family and adult gero preparing for the AANP or ANCC exam. This, of course, you do on your own. It's me teaching through all of the material, videos that you can watch over and over, broken down by system, a downloadable PowerPoint workbook with images included for you to help with the review. As I'm teaching, it's the same PowerPoint on the screen, so it helps to navigate through. That's also linked in the bio. We do have a 5-week review course that I do periodically throughout the year that are group courses. Our next one is June the 10th, where we work through all of the material. We do live practice questions once a week. And then our last week is an individualized week where I work with each review student for their own session based on the assignments that you have submitted, gauging where you are, engaging your exam readiness, and giving you feedback and advice for how to move forward after the course. And then lastly is my one-on-one option, which is our most common option. One-on-one, either assessing your exam readiness or weaknesses that you have. You want to spend time just reviewing just those, or the custom package where you may have been unsuccessful before and are trying to gauge where your weaknesses are and where you should change your studying and how to do that. With that, we identify where you went wrong on the boards. We create a study plan, work alongside you during that period of time that you have allotted that you want to study and get you from unsuccessful to successful. So those I always say, give us a call, shoot an email to us because that's strictly based off of what you need, where you are. And so I can only gauge what you really need by discussing your story. So call us, reach out, email, or you can do an inquiry on the website that's in the bio also. But that's everything. So if you need us, I am here. But as always, make sure you meet me back here. Happy studying. Bye, y'all.